What is a metrorrhagia? Metrorrhagia is excessive uterine bleeding both when you would normally have your period and in between your periods. It's a combination of two different conditions, menorrhagia, which is heavy bleeding during your period, and metrorrhagia, which is when your period lasts more than 7 days or you have spotting between periods. Metrorrhagia is excessive uterine bleeding, both when you would normally have your period and in between your periods. It's a combination of two different conditions, menorrhagia, which is heavy bleeding during your period, and metrorrhagia, which is when your period lasts more than 7 days, or you have spotting between periods. However, doctors prefer the term abnormal uterine bleeding now because abnormal bleeding is a symptom that can be caused by many different conditions. It's a common condition that affects between 10 and 30% of women of childbearing age. In fact, abnormal uterine bleeding is the most common menstrual disorder among premenopausal women. It is not always serious, but it can have serious underlying causes, so it's important to see your doctor if you're having problems with heavy menstrual bleeding. What are the symptoms of metrorrhagia? The symptoms of abnormal uterine bleeding will vary depending on the cause but may include heavy bleeding during your period, periods that last longer than normal, irregular menstrual cycles, bleeding that occurs at unusual times such as between periods or after sex. What causes metrorrhagia? There are numerous conditions that can cause abnormal uterine bleeding. Some of these include fertility and reproductive issues, fluctuating hormone levels, ectopic pregnancy, miscarriage, pregnancy, perimenopause, vaginal atrophy, and random ovulatory cycles. Endocrine system issues like polycystic ovarian syndrome, also known as PCOS, hypothyroidism, hyperthyroidism, or changing or stopping hormonal birth control or therapy, can also be culprits. Cancer or precancerous conditions such as endometrial cancer, which is uterine cancer, endometrial hyperplasia, a thickening of the uterus's lining, vaginal cancer, ovarian cancer, cervical cancer, and uterine sarcoma are serious causes to consider. Medical conditions like systemic diseases such as kidney or liver disease, celiac disease, blood clotting disorders, and low platelet count can lead to abnormal bleeding. Infections like pelvic inflammatory disease, cervicitis, chlamydia, gonorrhea, endometritis, and vaginitis are also potential causes. Other uterine conditions like adenomyosis, cervical polyps, uterine fibroids, and endometrial polyps can contribute to metrorrhagia. Lastly, trauma, whether it's a penetrating or blunt injury to the vagina or cervix or sexual abuse, can cause abnormal uterine bleeding. How is metrorrhagia diagnosed? Your healthcare provider will talk to you about your symptoms, including how long you have had them. They will also do a physical exam, including a pelvic exam, a cervical exam, and a pap smear. Depending on your health history and exam results, you may need other tests. These could include a thyroid test, a pregnancy test, hormone levels check, a hysteroscopic exam to check the lining of your uterus for fibroids, polyps, or cancer, a pelvic ultrasound, and a biopsy of the endometrium. How is metrorrhagia treated? The treatment for metrorrhagia will depend on the cause and on whether you want to become pregnant in the future. Most doctors will start with medical management if they don't suspect you have a bleeding disorder. Some medical options for treatment include non-steroidal anti-inflammatory drugs, or NSAIDs. Medicines such as ibuprofen or naproxen sodium help reduce blood loss during your period and can also help with painful cramps. Birth control pills, or oral contraceptives, can help regulate your menstrual cycles and reduce heavy or prolonged bleeding. Progesterone may be used to correct a hormone imbalance and reduce heavy bleeding. Tranexamic acid, known by the brand name Listida, helps reduce menstrual bleeding and only needs to be taken when you are bleeding. Hormonal intrauterine devices, or IUDs, release a type of progestin called levonorgestrel, which makes the uterine lining thin and decreases menstrual blood flow and cramping. If your hormone medicine causes abnormal uterine bleeding, your doctor may change or stop your hormone treatment. Iron supplementation might be suggested if you have anemia, a low iron level, or iron levels that are low, but not yet anemic. Some causes of metrorrhagia are best treated with surgery. Depending on the underlying cause, surgical options may include uterine fibroid embolization, which gets rid of fibroids by cutting off their blood supply, using tiny particles put into the uterine arteries, causing the fibroids to shrink. Myomectomy is another option, which gets rid of the fibroids but keeps the uterus intact, allowing women to still become pregnant naturally after the procedure. For women who do not want to become pregnant in the future, uterine ablation may be the best option. In this surgery, the lining of the uterus is destroyed, which can be done with laser, heat, electricity, microwave energy, or freezing. If hormone treatment fails to control abnormal uterine bleeding, your doctor may suggest removing your uterus as a last resort through a hysterectomy. This may also be necessary if cancer is the cause of your Metrorrhagia, possibly followed by radiation or chemotherapy. Thanks for watching. If you find this video informative, like, share, and subscribe.